All right, want to bring in Dr. Todd Ellerin, epidemiologist and chief of infectious diseases at South Shore Health in Massachusetts, for more on this. Dr. Ellerin, thank you so much for joining us. The CDC says, good morning, the CDC says the vaccine helped eradicate polio in 1979. Do you think it's something that we still need to have, the polio vaccine?
Absolutely. The polio vaccine was a groundbreaking leap in public health, transforming fear. Really generations that previously were in fear of their children, their kids becoming paralyzed, and transforming it where we haven't seen a case of polio that has arisen in the United States since 1979.
There have been some cases reported. We've seen some sort of resurgence of polio in places like Gaza, where officials discovered the first case in 25 years there back in August. Now, UNICEF reports children are being left paralyzed because they don't have access to the vaccine. If mandates are overturned, could we see that in America, resurgence of polio here?
Absolutely. I mean, let's think of remember, in the U.S., it's been eradicated, but around the world, there are still cases, but we are close to eradication. In other words, there's probably, last year, there was about a little over 500 children that got paralytic polio. So, you know, the good news is that we're close to eradication. The bad news is that we've been close to eradication for about 20 years. So the problem is access. There's conflict. As you know, there's a lot of mistrust. And there's one other part that I want to explain. In the United States, we use the injectable vaccine. It's called the inactivated polio vaccine. We've been using it since 2000. There's an oral polio vaccine as well. See, that vaccine is easier to distribute around the world because it doesn't require cold chain. You don't have to refrigerate it. It just drops into the mouth. It's very effective, but there are rare cases of reactivation polio. So we have to figure out a way of eliminating that and basically getting to these countries that can be very challenging to get to. I do believe that it is in our reach, but we're not there yet.
Right, and they so desperately need it. Kennedy has also falsely claimed that childhood vaccines cause autism, even though the study claiming that link has been retracted, and numerous other high-quality studies have found no evidence that vaccines are tied to autism. Kennedy has also said he's not opposed to all vaccines. Do you want to bring up this interview in Time magazine recently? Trump indicated he and Kennedy would hold a big discussion about the rising rate of autism diagnosis and would consider getting rid of some vaccines. So in the medical community, doctor, is this something that has come up, the connection between vaccines and autism, the possible connection?
I want to be clear about this. Vaccines do not cause autism. The MMR vaccine, measles, mumps, and rubella vaccine, does not cause autism. But you're correct, autism is on the rise, and there are probably various genetic and environmental factors. We're probably also diagnosing it more as we become more familiar. It's a real problem. I mean, you know, one of my closest friends has a child with autism. This can be, you know, obviously it's incredibly challenging illness, but it is not caused by vaccines. There's been study after study that have shown that even with vaccine skepticism, even as the MMR vaccine, for instance, is being taken up less and less around the world, all that leads to is measles resurgences, and autism still increases. Why is that? Because the MMR vaccine does not cause it. That was based on a study many, many years ago from 1998 that looked at 12 children that tried to link autism with the MMR vaccine. As it turns out, it was a fraudulent study, which is so unfortunate. 3 of the children never had autism. 5 of the children had autistic symptoms before they ever got the MMR vaccine. And the lead author was involved in a medical legal case where he was being paid to try to link the MMR vaccine with autism. It's so unfortunate that this has caused an echo chamber of mistrust, and it's a problem. We are seeing measles surge throughout the world.
And it's their statements that could really confuse parents as they try to decide which vaccines to give their kids. Glad you're clearing it up, doctor. But Kennedy has also discussed the ingredients that go into food here in the U.S. So let's talk about that. One example he brings up are Fruit Loops. Kellogg's, the company that makes the cereal, took out certain ingredients in countries like Canada and replaced dyes with natural fruit juice concentrate. So will doctors support some of his concerns when it comes to this topic, removing some of those ingredients that exist right now in cereals here in the U.S.?
Absolutely. There is no question that we've just recently heard that 75% of the U.S. is either overweight or obese. Ultra-processed foods are a problem. There are too many chemicals in foods that we need to have a step in the right direction. You know, Stephanie, that there are food deserts across the country. There is so much that can be done here. This is an exciting and important time to really make a change with the type of food that we eat in the U.S.
Dr. Ellerin, thank you so much. Chief of Infectious Diseases at South Shore Health. Thank you. Appreciate your time.